Thank you. Well, as stated, I'm Linda Wall, a volunteer outreach coordinator. Mountain Valley Hospice and Palliative Care is near and dear to my heart. We provide services to those obviously facing serious illness and of course their extended family. We do this in 17 counties from 8 different locations. We have 6 offices and 2 hospice homes. And our area spans Northwest North Carolina and Southwest Virginia. So that's within 2 states as well. We have 10 locales counting our resource shops. We have 2 of those. And currently I am serving in the Surrey County area. And I have worked with hospice volunteers now for almost 6 years. And I'm going to share my screen here just for a moment. So we started in 1983. We actually were were even prior to that, but it was not recognized through the Medicare system. It was strictly a volunteer program through the Altrusa Club in Mount Airy. We were formerly Hospice of Surrey County. We merged with Northern Hospice of Surrey County in 2005, and that's when we became Mountain Valley Hospice. Like I said, we serve 17 counties, and right now we are serving about 410 patients in hospice itself and 200 people in palliative care and transitions, which are programs to help people as they are moving into hospice. And this is just shows our area. So it is a pretty big area, pretty large amount of people that we serve, but we're so blessed that we get to do it because it is rural and it is communities that are underserved. This is our hospice, our Wells Hospice home in Dobson. I said we had 2 inpatient facilities. The other one is in Yadkinville, the SECU Hospice home. So when I came to work for hospice, I had limited knowledge of hospice. I got involved specifically because of experiencing loss myself, and so I didn't know a whole lot about what hospice is and what hospice does, and many people do not understand hospice as a whole. I spend a great deal of my time as part of my job doing outreach like this session, with the intent of helping the public understand that hospice care is and that it's designed to provide support to not only the patients and their loved ones, and equally the caregivers during this final phase of life. Hospice care focuses on comfort, obviously, and provides that better quality of life with the goal of enabling patients to have that be as alert as possible and totally as pain-free as possible so that they can live each day as fully as possible until the end. Hospice is available to people living with end-stage disease, cancer, pulmonary disease, ALS, heart disease, HIV, right now COVID, dementia, Alzheimer's, any other life-threatening illnesses. And quality information really is essential, which is why we do have so many outreach things. If individuals and their loved ones are to be prepared for those choices that have to come at that serious illness and that end of life process, not knowing about hospice and palliative care means not being able to choose a comprehensive approach to care at one of life's most challenging and vulnerable times. The majority of Americans, I'd say about 80%, the last statistics I saw, say that they would prefer to be cared for and die at home. And yet only 36% receive hospice care, which is what our main focus is enabling that. Mountain Valley Hospice Palliative Care believes that the best time to learn about hospice and ask about hospice is before hospice services are needed. Fully benefit from all the services, like Randy was saying, we have quite a bit of services. We try to make sure that we are holistic and look at all the parts of people's family and life and their needs during this time. And and we want to make sure that people are optimally connected, and they can get their care as soon as their prognosis of a life expectancy of 6 months or less has been reached.
Right.
So individuals are usually referred to hospice by their personal physician, although individuals can be referred by their family or even themselves. Soon after a diagnosis of a life-limiting illness, patients and their families should consider, all their care options so that they are better able to fully make those informed decisions. And the earlier that a hospice can become involved, the greater the benefits to the patient and the family. So at the center of hospice and palliative care is the belief that each of us has the right to die pain-free and with dignity, and that our families will receive the necessary support they need to allow us to do both of those things. Dame Cicely Saunders, she was a nurse, physician, writer, and founder of the hospice movement. And this quote speaks to the whole philosophy of hospice. And she said, "You matter because you are. You matter to the last moment of your life, and we will do all we can, not only to help you die peacefully, but also to live until you die." And I think that speaks to who Mountain Valley Hospice is. We are so blessed with the honor of serving not only our patients, but their families, and like I said, their caregivers as well. People often think that working for hospice must be hard, and yes, we do see our share of pain and death, but the blessings of being there when we're needed most makes up for that. And the many services that we offer help families get through this most difficult of times. And many families tell us that they wish they had contacted us sooner. Mountain Valley Hospice provides choices about how patients may want to live out their lives and help with the decisions regarding the kind of care and the treatments that patients do and do not want. And the plan of care is customized based on the input from those patients, from their families, from the physicians, and of course, our care team. We have many patient and outreach programs to fulfill the needs of those who we are medically serving, but also the community as well. We have several programs because we are a nonprofit. We take and put that money back out in the community, and some of our programs include for the community at large, Alzheimer's and grief support programs, Kids Path, which we do have children that are in the process of dying, but we also have many children that are in the process of grieving. So we have summer camps. We didn't this year, unfortunately, because of COVID. We have a We Honors Veteran program, and like you have mentioned, our Pet Peace of Mind program, which I'm very active in. All of our services are provided by a professional coordinated team, and this team draws upon many different kinds of professionals who provide that medical care and their support services. And this team is called the IDG, or the Interdisciplinary Group. These professionals work together to meet at a minimum of once every 2 weeks to discuss each and every patient and collaborate on those individual patients. The changes and the needs, they talk about the changes and the needs that each may have. Witness, say if I'm out and I see something, and then they plan the patient's care going forward based on all these different findings by these different groups of people. The Hospice Interdisciplinary Group team, it serves individual professionals whom I'm going to expound on slightly. Social workers, their services deal with the psychosocial and socioeconomic needs and issues that families may have. Mountain Valley Hospice provides 2 levels of social workers. One who deals specifically with the patient's personal issues, such as if they're a veteran or if they have financial issues. The second group specifically is designed to address the needs of the family after the patient passes. And this bereavement counseling and support is provided to the family for up to 13 months or longer if it's needed after the death of their loved one. Of course, we have chaplains, and they provide that spiritual support for both the patient and the family. They may even do the final services. We have hospice aides and nurses, and they provide that physical daily care and the physical, taking care of those needs that happen on a day-to-day basis. Now, hospice is covered by Medicare and most commercial insurance, but hospice insurers, including Medicare, don't generally pay for round-the-clock home care or nursing. So this is not like a nursing facility. And so that's where our primary caregivers come in. They are people in the family, generally, that we work with side by side to meet all their needs. And in addition, hospice, there are lots of experimental treatments, clinical trials, or other medical services that are aimed at curing the disease that are not covered. We're talking about end of life, not about curative care. We're about end of life care. And our organization is committed to providing the best care for those we serve, regardless of their ability to pay for services, which is really important. And being a nonprofit, that's what we do. Of course, the physicians or medical directors, as they're called, they're the one who determines if a patient is ready and eligible to receive hospice services. And thereafter, the patient can choose our physician as their caregiver, or they can use their personal physician. They're also welcome to be part of our hospice team. Patients can take the initiative and begin the discussion with their personal physician, or they can request an evaluation directly from our hospice program at any time. And even if it's found that the patient's not ready for hospice right now, like I said, our patients may benefit from palliative support and advanced care planning, which we offer through our palliative care program. And lastly, and this is the one that's connected most to me, are our trained volunteers. Mountain Valley Hospice offers comprehensive palliative and support services through these professional employees, but not without that support of the lay volunteers. Volunteering is, like I said, the piece that's nearest and dearest to my heart. I've been working with volunteers or have been volunteering myself for over 35 years. Volunteers provide invaluable support and companionship to caregivers and patients served by hospice. And those volunteers play such a vital role in our organization. They give from the heart, and the love and the compassion that they show makes a difference every day in our patients' lives. Although I have worked side by side to benefit our company, I work with the volunteers, for over 6 years now. I really had no idea of all that our volunteers actually did to benefit our company until this whole COVID-19 situation started. The coordinators like myself have been extremely busy during this COVID-19 thing, because we've been trying to cover for all these odd jobs and things that our volunteers normally did for us. And we see the jobs being assigned, but until you actually do it, you don't realize how many that there are. So volunteers can help patients do a lot of different things, like life review. They can do office things like answer the phones, filing, make copies, put together new patient packets. We use volunteers to help in our bereavement program that I was speaking about. They help with bereavement mailings. We're making phone calls to check on bereaved families, or even making visits when needed. Some volunteers help in our special projects. They could be helping with fundraising events. Others help by making prayer shawls for our patients. There are opportunities to serve, and we will try to fit it to whatever the volunteer likes to do. Like I said, we have the Pet Peace of Mind program, where the focus is keeping the pet with the patient for as long as possible. And volunteers help with delivering supplies or pet food to the patient, or even taking the pet to the vet if and when they need to go. Like I said, we have the Veteran to Veteran program. It's really good to pair a veteran volunteer with a veteran patient, because they understand each other's life journey, and they can relate to each other and they build wonderful relationships together.